Good afternoon, everybody. So just to give you a little bit of background, my background is in health and social care, adults, children's, charity, and government. So I've been working in this environment for probably, goodness, the last 15 years, and then come over to insurance. So I'm kind of going to provide you a little bit of a whistle-stop tour, but I have loaded these slides so that you have the ability to reflect back on them. Please bear in mind that some of the information that I'm going to give will not be specific to you because of the bespoke nature of how COVID-19 and issues regarding risk are affecting everybody. However, if you do have specific questions relating to your provision, your charity or service, obviously if you ask those at the end, then as Jonathan said, we can get those out to you. Matt, if you want to flip over to the next slide. So the current landscape, we've been assisting people since beginning to mid-February in regards to COVID-19. One of the significant things that we've seen is obviously the impact across adults and children's health, social care, communities and charity sector. And that due to the vulnerable nature of the people you support and the nature of the things that you do, that is going to continue to affect us in the upcoming weeks and months. Again, I reiterate, there is no one size fits all, but there's certain principles that we can apply and keep in mind throughout risk assessment, health and safety. What I want to really focus on, I think it's something Howard touched on, is business resilience and how you ensure that not just now, but everything on renewal, you can keep that information to hand. If we flick to the next slide, this is quite a good diagram for you to think about where you are in your own recovery plan, to think about whether you have been a service that has seen interruption, i.e. furloughed staff, closures, or that you have diversified to more virtual settings, remote working, or whether you have continued to do what you do but with restrictions. One thing that is really important in regards to recovery planning and business resilience is considering where you are now and where you wish to return to. That is difficult for many of us because we don't know what restrictions is going to come in. But there are certain themes of training, communication, consultation, liability reduction, looking at governance, PPE, and limited infection control that remain central for all of us. If we flick to the next slide, Matt, I've quickly given this summary, which kind of looks at the 5 areas specifically that we found that clients are seeking help on. And this provides a really good risk management comprehensive mechanism for your governance plan, both now and into the future. Obviously, recovery planning, and that takes a different feel depending on what situation your organisation's in. Looking at risk assessment, something we generally should be rather good at. However, we also need to consider scenario testing and gap analysis because a lot of the time there are uncertainties within that risk assessment. PPE and something called PPE competencies. I will get onto this a little bit later, but Jonathan will be sending out 2 free documents from ourselves. One of them looks at PPE competency, and I'll explain that slightly more a bit later. Government guidance, which depending what sector you come from, depends what your experience will be of it. If you are education and some of the children's services and provisions, I am sure you will have some interesting times because there's been a whole gap for much of that sector. Even in adults, there's been numerous difficulties. And of course, liability reduction, which again, I think Howard's touched on slightly. So if we move on and start quickly with recovery planning. Recovery planning is about looking at where you are, creating a phased transition, and making sure, Matt, if we flip to the next slide, please. Looking about where you are now, being realistic about where you want to go to, making sure you have consultants, not just with service users, multi-agency facilities, what they're planning to do, especially if they're alliance and interaction. Also thinking about what employees want and whether they're going to return to work. Are there caring opportunities? Are they shielding due to underlying health conditions? All of these must factor into your plan as you move forward. You need to have a phased approach. So within that, we suggest looking at triggers that will move you from, say, step 1 to step 2 and continuing down that line. Also, given the government's consideration of the R value or the R rate, all recovery planning or governance strategic planning needs to be able to move forward and backwards. Should we go into restrictive or more restrictions, you need to be able to stop and move backwards. So those are essential. But obviously, the key of this is recovery planning is about what you're doing. If you have competitors, commissioners, you need to consult and look at what they're doing, but you also need to think about the nuances of your own service. If we flick to the next slide, and I will leave it so that you can have a look at this in more details. This is an example of phase 1 planning. We provide and have implemented a 6-phase recovery plan, but this kind of gives you the ideas of the heading, how you would move and trigger to a phase 2, what you'd be required to do. So I've left that example in so you guys can have a look at that in your own time. Moving on to risk management, I would say most of us have probably done a risk assessment at some time or another. I think it's understanding the complexities of risk assessment currently, and whether it's not just a risk to somebody, but it's a risk from somebody. A lot of people we've worked with understood that there was risk to staff of, not social distancing, of personal care, of challenging behaviours or behaviours that challenge. However, didn't think there was also risk from staff due to additional stress, due to the logistics of them getting to work via public transport, due to underlying health conditions being asymptomatic. So it's about really, really interrogating those risk assessments, whether it be from service users, staff members, a risk to business, so that's your continuity planning and your recovery plans. Also, and I will get more into PPE, use, supply and failure of PPE and issues relating to that, and specific COVID-19 risk assessments, looking specifically at the changes from current risks or previous risks to risks that would now be in your service moving forward. So again, each service is unique. It's really important as well when we consider risk and any change that comes out of risk to make sure that we train the workforce on any changes that are being implemented in regards to policy, practice, things that you need to do now that you didn't do before. And ensure that we have good record keeping, ensure that we have good governance mechanisms, and that we can review things in a dynamic form. So moving forward, this one, PPE and infection control. Obviously, I know this has been on top of a lot of people's lists. Looking at, obviously, adult social care, some of the initial supply issues, generally we've seen in stockpiling, the use of hubs within organisations to be able to get PPE out to different locations. Obviously, the support from Public Health England if you are running low. If you have been a service where you have had an interruption period where you are not doing what you normally do, people are furloughed, and there's a few of you working from home, you may have not had to use PPE yet. I know in respect of certain special education provisions, there's a concept of householding and how you use that. But it's not just looking at the government's guidance that's specific to your sector, but also the government guidance that's specific to the public, especially where you have this dual mechanism within your organisation where you can be considered a household, but also considered a business with staff going in, and then also potentially using community services either now or in the future. Obviously, looking at risk mitigation strategies. Infection control, if you are a clinical unit of any sort, have nurses in it, you will be used to infection control competencies. What we are suggesting, and this is something that Jonathan will pass on to everybody, is the use of similar to medication competencies used in the care industry, is using PPE competencies to ensure, and this underpins that all your staff know what to do with masks, what to do with aprons, what to do with gloves, sessional working, what happens when there is PPE failure, how that is managed, where they report, how they dispose of it, whether it is laundry, taking out waste. All these factors need to be considered and then filtered into risk assessments and policies. So the competency leaflet that we will give out, you can nurture into your organisation. I think one of the other issues that we're having, if you work with anybody with communication needs, whether that be ASD, learning disabilities, there has been significant concern about the use of anything that has mouth coverings or makes certain noises or are different in regards to routine. There is some really good information from the Social Care Institute of Excellence. I would direct you to that unless you want to have a one-to-one conversation in regards to it. Flicking quickly onto government guidance, it is a bit of a minefield out there, depending on where you are. And I think it's essential that you are reviewing the most up-to-date guidance. And there's a lot out there. The alerts from the gov.gov site are really good to your email, simple way to make sure you're reviewing the correct policies. Also now they've addressed embedded links. So if you do take the link from a piece of guidance, you can then embed that straight into any documentation and it will automatically update. Do remember that it is your risk, and government guidance is a minimum, not a maximum. So if you feel that due to the nuances of your service, your provision, your staffing, your office, your environmental issues, it's really important to look at that. And whilst there are some areas of guidance and regulation and safeguarding, which we also get onto, is that have manoeuvred, like Mental Capacity Act, and their interim measures, issues such as HSE undertaking environmental risk assessments, fire risk assessments, you still need to be regulatory compliant. And if you are unsure of what element is doing what, you need to go back to the guidance from that regulator, whether it be the Charities Commission, whether it be, the nursing, HPC, there are so many regulators, but do make a list of those that apply to you, as well as government guidance, and also seek best practice guidance, whether it's NICE guidelines, Social Care Institute of Excellence, education guidance, those type of things. Okay. Moving on, liability reduction. There are some simple tips and tricks, and I think Howard alluded to some of these. Obviously, on renewal, insurers are going to want to see what you've done. Make sure that your plans are presented in such a way you can share them on renewal. Make sure you review policies and processes. Make sure you have clear record keeping and reporting in regards to decision making. Accident and incident, if you're not sure, report. Go to your broker. One thing I can say is the strength of the brokers during this period has been absolutely amazing. So obviously, anybody such as myself who has a health and social care consultancy, brokers such as Jonathan and Howard, where we're seeing such a large part of the sector, we are able to have discussions with you as to what other people are doing and provide suggestions. But definitely good governance, regular meetings, good data, responding to guidance. If you are unsure, again, it is going back to local authorities, Public Health England, commissioning bodies, NHS trusts, and having those discussions. And most are more than happy to help. While we have seen a little bit of delay from local authorities in regards more to safeguarding issues, actually, Jenny, from a strategic point, most local authorities have been relatively proactive. Obviously, the other issue is consider the health and safety side, environmental, logistics, access, visitors on site, whether that be visitors coming in through multi-agency functions or just people delivering the mail. Those are all elements that have to be considered. And the potential, if you are working in a sector where service users can be out and about, it is how you actually manage that. And obviously, the other thing I would say is always consider the impact of change, both on staff, service users, other agencies that you rely on, that you may be previously co-worked closely with somebody, their business or their support may be affected. And that's something certainly to consider, as it may leave gaps in your service. I think Howard alluded to it earlier. It is essential in regards to your business resilience and recovery planning that you look at scenario testing and that you do a robust gap analysis. So just moving on, just the key messages that I want to make sure that you take away. Obviously, ensuring business resilience, it is multifaceted. PPE, whilst it is the centre of a lot of things that have happened over the last few months, it must be part of an overall risk reduction strategy, and that is inclusive of infection control. So there is no standalone issues. Everything is connected in with everything else. Review and apply guidance regularly, and if you're not sure, obviously, again, brokers are very informed on this matter. Do go to the brokers, speak to Public Health England, local authorities and commissioning bodies. Ensure that you use ideas such as competencies to evidence that you have demonstrated to your staff how to do the changes you were requesting. Whilst we may have it in policy, it is essential that we tier that into frontline staff or active staffing. Training, obviously, regardless of whether it's mandatory, must be continued. And make sure that any changes have not just been communicated and emailed to staff. You must ensure that those are signed and recorded, because that, down the line, if there's a potential claim, demonstrates that you have done all that you can as employer. Finally, the nuance of businesses. You are all very different. I've had to, unfortunately, discuss things in relatively broad strokes. However, if you do have specific questions, obviously come through Jonathan, use the Q&A at the end, and I will try and give some more direct answers. But just as an idea of kind of what we've done and why we're coming from the position we are coming from at Markel Care, we have 30 consultants who remain active in the UK across adults, children, charities, communities, education. So we've remained active. We've delivered all our support off-site and virtually, including our training, health and safety support, recovery planning, COVID risk assessments, business continuity. All of our practitioners are experienced leaders, and a lot of the toolkit that we have developed is specifically for Markel Care. We have not used things that other people are using, but we've managed to develop this through testing it also within the sector. Obviously, we have a special relationship with innovation, and I'm sure that if you have any want to use our services, whether you are a Markel insurance customer or not, have that conversation with Jonathan and Howard. We do have specific offers and ability to work specifically with innovation in regards to some of the support that we can give. But I will leave you that Jonathan will send out to you all a PPE competency. We will also send you out a thought piece that looks in more detail to the aspects of liability reduction, specifically in relation to COVID-19. So hopefully that gives you a bit of a whistle-stop tour.
Thank you, Charlotte. Really informative. We did have one question, which I think you've kind of half answered. So are some of the deep drilling and questions that Charlotte is speaking about able to be purchased from a skill provider, e.g. improve our own systems? So I suppose, Mark, in answer to your question, that's piggyback on what Charlotte just said. Speak to your broker. So obviously you guys are with us, so have a chat with us if there's anything in particular. If it's something you need a specific skill set, we can source that for you. So as Charlotte said, even though I know you personally, you're not a Markel client, you are able to access Charlotte's team via ourselves. And I'm pleased to say, as of very recently, at a much discounted rate. So we'll send some information around on the types of services they offer. Some of the information is available free of charge if you're a Markel client. Other stuff like this, Charlotte kindly offers her time to support us free of charge, and other things that are specific to you will have a small charge attached to it.